Heart attacks have become a terrifyingly common health crisis, affecting millions of people worldwide each year. Despite advancements in medical science, they remain one of the leading causes of death. They often strike without warning, leaving devastation in their wake. The suddenness of a heart attack can be shocking, not just for the victim but for their families and friends as well. It is essential to understand this silent killer, its causes, and the steps we can take to protect ourselves and our loved ones. Knowledge is power, and by educating ourselves, we can take proactive measures to safeguard our health. This essay aims to demystify myocardial infarction, shedding light on its intricacies in a clear and understandable manner. We will break down complex medical jargon into simple terms that everyone can grasp. We will delve into the causes, risk factors, symptoms, and the importance of prompt medical intervention. Recognizing the early signs of a heart attack can be life-saving. Furthermore, we will explore the diagnostic methods used to identify heart attacks and the treatment options available to patients. From lifestyle changes to advanced medical procedures, there are numerous ways to manage and treat heart conditions. Prevention, as always, is better than cure, so we will discuss lifestyle modifications that can significantly reduce your risk. Simple changes in diet, exercise, and routine checkups can make a huge difference. Finally, we will emphasize the importance of raising awareness about heart health and encourage regular checkups to detect any potential issues early on. Early detection and intervention can prevent severe complications. By understanding heart attacks, we can empower ourselves to live longer, healthier lives. Together, we can combat this silent killer and ensure a better future for ourselves and our loved ones. Myocardial infarction, commonly known as a heart attack, is a serious medical condition that occurs when the blood supply to a part of the heart muscle is abruptly cut off. This blockage is usually caused by a blood clot that forms in one of the coronary arteries, the blood vessels responsible for supplying oxygen-rich blood to the heart. Without a constant supply of oxygen, the affected heart muscle begins to die. This can lead to permanent damage to the heart, reducing its ability to pump blood effectively. In the most severe cases, a heart attack can be fatal. It is crucial to remember that a heart attack is a medical emergency. Recognizing the symptoms and seeking immediate medical attention can mean the difference between life and death. The primary cause of a heart attack is coronary artery disease, a condition in which plaque builds up inside the coronary arteries, narrowing them and restricting blood flow. This plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. Several factors can increase your risk of developing coronary artery disease and subsequently having a heart attack. These risk factors can be categorized as either modifiable, meaning you can take steps to change them, or non-modifiable, meaning they are beyond your control. Modifiable risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, and an unhealthy diet. By making positive lifestyle changes, you can significantly reduce your risk. Non-modifiable risk factors include age, gender, and family history of heart disease. While you cannot change these factors, being aware of them can help you make informed decisions about your health. Recognizing the symptoms of a heart attack and acting quickly is crucial for improving outcomes. While some heart attacks can be sudden and intense, many start slowly with mild pain or discomfort. The most common symptom is chest pain, often described as a feeling of pressure, tightness, or squeezing in the chest. This pain may come and go or persist for more than a few minutes. Other common symptoms include shortness of breath, pain or discomfort in one or both arms, the back, neck, jaw, or stomach, breaking out in a cold sweat, nausea, and lightheadedness. It is important to note that not everyone experiences the same symptoms during a heart attack. Some individuals, particularly women, may experience atypical symptoms like shortness of breath without chest discomfort, nausea, or extreme fatigue. Section 5. The Golden Hour, Importance of Immediate Medical Attention. When it comes to heart attacks, every second counts. The decisions made in the first few moments can determine the outcome. Time is muscle when it comes to heart attacks. The heart muscle begins to deteriorate the moment it is deprived of oxygen. The sooner treatment begins, the less damage is likely to occur to the heart muscle. Immediate medical attention can prevent irreversible damage. The first hour after the onset of symptoms, often referred to as the golden hour, is critical for survival. This period is the most crucial for effective treatment. Calling 911 or your local emergency number as soon as you suspect a heart attack is crucial. This ensures that help is on the way immediately. Do not attempt to drive yourself to the hospital or wait to see if the symptoms subside. This can waste precious time and increase the risk of severe complications. Early medical intervention can significantly improve chances of survival and reduce the risk of complications. The medical team is equipped to handle emergencies efficiently. Emergency medical personnel are trained to provide immediate care, including administering medications and performing procedures that can help restore blood flow to the heart. Their expertise can make a life-saving difference. Remember, acting quickly can save a life, potentially your own. Quick action can lead to a faster recovery and a better quality of life post-treatment. Do not hesitate to seek help if you experience any symptoms of a heart attack. Your prompt response can be the difference between life and death. Section 6. Diagnosis. Unveiling the silent attack. Diagnosing a heart attack involves a combination of medical history, physical examination, and specialized tests. When you arrive at the hospital, doctors will immediately assess your symptoms and vital signs. An electrocardiogram or ECG is one of the first tests performed. It records the electrical activity of your heart and can help detect any abnormalities caused by a heart attack. Blood tests are also crucial for measuring specific proteins called cardiac markers that are released into the bloodstream when the heart muscle is damaged. Elevated levels of these markers can confirm a heart attack diagnosis. Other diagnostic tests may include echocardiography, coronary angiography, and cardiac MRI. These tests provide detailed images of your heart, helping doctors assess the extent of damage and plan appropriate treatment. Section 7. Treatment options. Navigating the path to recovery. Treatment for a heart attack typically begins immediately upon arrival at the hospital. The urgency of the situation cannot be overstated, as every second counts in minimizing heart damage. The goal is to restore blood flow to the heart as quickly as possible and minimize damage to the heart muscle. This often involves a combination of medications and procedures tailored to the patient's specific condition. Medications are often the first line of treatment. These drugs work to stabilize the patient and prepare them for any further necessary interventions. These may include aspirin, which helps prevent further blood clot formation, and other antiplatelet agents that reduce the risk of additional clots. Clot-busting medications, also known as thrombolytics, can dissolve the blood clot blocking the coronary artery, restoring blood flow to the heart muscle. In some cases, doctors may recommend a procedure called angioplasty. This minimally invasive procedure can quickly open blocked arteries. During angioplasty, a balloon-tipped catheter is inserted into the blocked artery and inflated to open the blockage. This helps to restore normal blood flow. A stent, a small mesh tube, may be implanted to keep the artery open. This ensures that the artery remains clear and reduces the risk of future blockages. For more severe blockages or complex cases, coronary artery bypass grafting, or CABG surgery, may be necessary. This is a more invasive procedure but can be life-saving. This procedure involves bypassing the blocked artery by grafting a healthy blood vessel from another part of the body. The new vessel creates a detour around the blocked artery, allowing blood to flow freely to the heart muscle. Section 8. Prevention is key lifestyle modifications for a healthy heart. While some risk factors for heart attack are beyond our control, many lifestyle modifications can significantly reduce your risk. By adopting these healthy habits, you can protect your heart and improve your overall well-being. Quitting smoking is one of the most important steps you can take. Smoking damages blood vessels, increases blood pressure, and reduces the amount of oxygen available to your body. Maintaining a healthy weight through a balanced diet and regular exercise is crucial. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Managing stress through relaxation techniques such as deep breathing or meditation can also benefit your heart. Chronic stress can contribute to high blood pressure and other risk factors. Section 9. Awareness and regular checkups, your best defense. Raising awareness about heart health is paramount in the fight against heart disease. By educating ourselves and our loved ones about the risk factors, symptoms, and importance of early intervention, we can save lives. Regular medical checkups are essential for monitoring your heart health even if you feel well. Your doctor can assess your risk factors, monitor your blood pressure and cholesterol levels, and recommend any necessary lifestyle changes or medications. Remember, Knowledge is power. By taking charge of your heart health and staying informed, you can live a longer, healthier, and more fulfilling life.